Hi, I'm Tiffany Alexander. I have a master's degree in counseling and I'm a licensed professional counselor in practice for 10 years. Anxiety disorder usually is a fear-based problem that a lot of people suffer from at different points in their time. It can in their life. It can be from childhood all the way to present day. It could be something that's happened more recently and it's kind of interweaving into other parts of your life. Some people have the more severe spectrum of having panic attacks. Uh, Panic attack is your body responding to the environment as if you're dying. Your body actually thinks it's dying, so it's releasing tons of adrenaline, and you feel like you're dying when it's actually just the body's overreaction to some perceived threat instead of an actual threat. Those are usually based in a fear, and it can be simple fears like a fear of loss of control. And they can kind of manifest in, heights or flying or anything where other people might be involved in the control and the person's not in control. It's not really necessarily the heights sometimes. Like a generalized anxiety disorder is almost fear of a fear. And it kind of just manifests in all different places. And you see a lot of negative self-beliefs involved in that, where the person in the back of their head is kind of thinking negative things about themselves. They're kind of a negative narrative going on in the back. You're not good enough. Other people are going to see you're not smart enough. Just this negative stuff, and it causes anxiety to go up because there's that fear. There's that threat. A real threat is going on. It's just internal. And there's lots of things you can do about that. There's medication, obviously, that helps take the biological symptoms down a notch or two. There's also therapy that you can do to help to address what are those fears, what are those negative self-beliefs you have. There's EMDR that helps to bring down traumas. So if this fear came from an actual situation that was embarrassing or terrifying or something like that, you can work on that, and it tends to take out a lot of the fears in the present. EMDR is eye movement desensitization reprocessing. It's a form of therapy that helps people go back in time into a memory. Oftentimes you look for a memory that still has an emotional impact. So when the person brings that memory up, they still feel the feelings they would as if they were in that situation currently. So you take that and you stimulate the eyes. Usually it's a bilateral stimulation straight across. There's also, you can do it with sound for the ears. Tappers do for touch. Anyway, like that, but it's bilateral stimulation for the whole body, and it helps to get into the part of the brain that has that emotional memory kind of frozen and free up that emotional part. So a lot of times people will express a lot of emotions while they're doing it, but then afterwards they almost immediately have a sense of calmness about them, and very, very frequently they report lowered anxiety from that point forward. That particular memory is never as traumatic to go back to as it ever was before. Anxiety can come across in children a couple of different ways. There's a lot of different diagnoses that get kind of mixed up in kids because a depressed child can look a lot like an anxious child. A depressed adult and a depressed child are two different things. They don't manifest the same way. So you have some depression, anxiety, ADD, they can all kind of look the same in children, and you really have to, since they're not as verbally expressive as an adult and as in tune with themselves, you really have to look a little deeper to find out what's really going on, what's the underlying issue to be able to treat it correctly. There's medication, but a lot of those medications do have some potential for abuse and dependence, so I could see why a lot of parents would be very reluctant to start that way. If you're working with a small child who has anxiety, play therapy is a great thing where, since they're not as verbally able to discuss what's going on and understand and be in tune with themselves, they play out the roles with the toy with a therapist. People are specifically trained to work with small children in this kind of way that's a nonverbal form of therapy to work through different situations, to find out what the situations are that's, they're kind of in the anxiety, and then to help them work through it and come up with better ways to handle things so they feel a little bit more safe. Therapy is, I think, the best treatment for anxiety disorder. Otherwise, medication it mainly treats the symptoms. With some people who have severe anxiety, you can't treat the fears unless you get the symptoms reduced, so maybe very necessary. Some people just biologically may need to, kind of have sensations turned down a notch. But therapy really addresses the underlying causes of the anxious feelings and all that stuff. All that stuff is a symptom, so it really addresses where that symptoms are coming from so that the person can really get some relief.